Okay, so my name is Bryan Garcia. Pronouns are he, him, his, and I will be talking about, I'll be focusing on queer health in the Central Valley with a focus on mental health. So more about me. So like I stated, my name is Bryan. I am from Merced, California. I was not born in Merced, but I was raised most of my um, life before coming to college at UC Davis. And at Davis, I studied genetics and sorry, that's a typo. I'm studying genetics and genomics, and also Chicanic studies with a minor in public health. Um, and as a first gen college student, I hope to advocate, promote, and emphasize the importance of health for the intersecting identities of queer and BIPOC folks within the Central Valley. So more about my project is that the issue that I wanted to focus on was the lack of resources and the lack of advocacy, promotion of mental health for queer folks in the Central Valley. And so with that, I would like to focus on two objectives, which are move forward in bringing mental health awareness and be inclusive of queer BIPOC folks, as well as being able to help contribute to the wellness that is received through mental health resources and services and the accessibility to queer folks. So before starting, I wanted to take the time to define queer and queer health and what it is. So the term queer for some, this is a reclamation reclamation. This reclamation is a celebration of not fitting into social norms. These social norms could be due to social norms within our society, which are usually straight and being identified as cisgender, those heteronormative practices. But also it is important to acknowledge that not all people who identify as LGBTQIA+ use this term to describe themselves. And as Planned Parenthood defined this word, it is a word that describes sexual and gender identities other than straight and cisgender. As for queer health, I really like the description and definition that community health scholars provided, it's all about the health topics that include but are not limited to HIV and AIDS, mental health and well-being, drug and alcohol use, sexual and reproductive health, universal health coverage, access to affordable medicines, and training of the health workforce, which is portrayed from LGBTQIA+ folks who are among an oppressed population in regards to health and all that. So going to the literature review, I feel like going into like the literature review, it was kind of limited, also due because there isn't much research done within the Central Valley regarding queer health. But from what I was able to gather through the literature was that there are limitations to rights and protection of youth, LGBTQIA+ youth folks, which usually comes from the lack of support received from these communities. And the communities could either be identified as families, schools, faith communities, and just the organizations present in, we could say counties or just in the environment that these folks are in. This does result in queer folks having to compromise their mental health due to the social determinants that they may also experience or that are present due to their background. A study showed that compared to heterosexual youth, LGBTQIA+ youth are more likely to report suicidal thoughts or attempts, experiencing more major depression, anxiety disorders, substance abuse, and other mental health illnesses. And it's something that is significant because this is a marginalized community, and within the marginalized community, there are marginalized groups. And Also, I wanted to focus on the primary way of receiving mental health treatment, which is usually through local clinic and medical centers. And this is a contributing factor as to the mental health equity, which is due to the patient to clinician mismatching, like stated in the literature, which also focuses on the white supremacy and Anglo-white centered and heteronormative practices. So regarding my survey, just like an overview of what it was and like, yeah, just an overview. As you can see on the left, it shows like the samples of the survey. Just some of the general questions that I wanted to focus on, which was gender identity, the counties within the Central Valley, ethnicity, and whether or not they qualified or had health insurance. So my survey was distributed through social media platforms. It was a Google Form survey. Like I stated, there were a total of 29 survey responses, but two of the survey participants had to be removed due to not originating and or currently just residing in the Central Valley. I did also conduct interviews. I had a total of 7 participants who showed interest and were part of the one-on-one interview process. And yeah. So going to the results, I included these graphics because I feel like they correlate with each other. So like for the example, like the right graphic, it states how likely is a community to reach out to community organizations. And this is with the context in which like how likely it is for one to reach out to these community organizations when going under like emotional distress or just when dealing with these mental health illnesses. And majority and most of the responses and participants indicated that they're mostly unlikely to reach out to these community organizations, which I feel like then relates to the reason as to the graphic on the left, which shows if you were to be asked, where's the nearest LGBTQIA center in your county, would you be able to provide that information? And most of the respondents or participants stated that no, they would not be able to provide that kind of information, which I feel like ties in as to like why they wouldn't reach out to community organizations because of that lack of knowledge there is of these resources. Going into further results, I included here a table explaining or just, yeah, explaining the reasons for limitations in expressing and or exploring identity. From the literature review, I was able to make this point that LGBTQI plus youth compromise mental health due to family conflict or child maltreatment. And I thought that the interviews and open-ended questions were to support that point, as I was able to identify the common themes in the responses from this question, which was the most important ones were family and community, queer spaces and centers, and mental health services or like specialists and all. So for like the family and community theme, regarding the question of, do you think there are limitations when it comes to being able to explore and or express your sexuality or identity within your current environment? And these respondents did state that yes, there are limitations, and the common responses was due to parents and the older generation that that makes up most of the population within these counties. And the limitation comes from different beliefs and like traditional morals, especially within the BIPOC community. Also, like stated also in the other presentations, usually Central Valley counties are more conservative. So that is, I guess concluded that it's more of like a closed-minded community due to that belief. Due to also the how they express and how they treat queer folks as less compared to the rest of society, as well as how queer folks need to stay cautious of the environment to avoid being discriminated, sexualized, and or intimidated by conservative folks, which just contributes to the dangerous environment that these folks may come across. And for queer spaces, the limitations present would be the lack of sustainability within these resources and centers. Most of them, they're not able to like sustain and stay fully open. They do close down, and respondents were able to voice that out, that they wish there would be resources and centers that would remain open and have that consistency and sustainability. As well as, like I stated, there's no knowledge of these resources provided or that are in the Central Valley. So they're just not aware of the centers that provide mental health resources or services for queer folks. As well as the lack of effort, the lack of awareness, and the lack of promotion of these services within the community. So yeah. And then also to take into consideration that centers are not close in proximity, usually distance, the lack of public transportation as well, just adds to the limitation and contributing factor that they won't be able to access those centers or resources. For mental health services, participants expressed that health insurance was also a factor to this limitation, as some health insurances do not provide the necessary resources for queer folks seeking mental health treatment, as well as the difficulty in finding queer, affirming, or competent mental health specialists. And also, many express that this limitation comes from the lack of training and representation within these spaces, of being able to understand what it is about being BIPOC and part of the LGBTQIA+ community. So that lack of being inclusive. As for this result, I was able to focus on these two questions, which I thought it was necessary to present the age groups that most participants pertain to, which was 18 to 24, which is usually like the younger population. And I feel like this correlates to the graph on the right, as it states that, or it asked, does the county you originate from and or currently reside in creates a safe space for LGBTQI+ BIPOC folks? And majority of participants stated no. And yeah, so I feel like that limits or adds to the limitation that this specific age group, or like what is mostly voicing their concerns, are not currently like feeling that comfortability of expressing themselves. And I also included the I do not know option, because in certain cases, even though you may identify as being part of this marginalized community, due to the environment you're in, you're not aware of the safe space or the lack of safe space there is within these counties. So I thought it was important to allow people to express that. So for my conclusions regarding the data collected, the collected data and the literature was that majority of population that are voicing their concerns and opinions are the youth, like stated from the collected data. And I also wanted to acknowledge that, since I did state that there are resources, but sometimes the lack of resources does not always mean that there are no resources, if that makes sense. So the lack of promotion of these resources do affect the mental health and well-being of LGBTQI+ and BIPOC communities, because usually these resources do exist, but there's just that lack of promotion. And I also indicated that intersectionality must be taken into consideration when treating and discussing issues regarding queer health. Like stated, the LGBTQI plus community is a marginalized community, and within that community, there are people who may identify with other identities, which is where the intersection comes into place. So making those resources more inclusive. And community organizations, I concluded that lack inclusivity to LGBTQI plus BIPOC folks and community because due to my community engagement, I was not able to partner up with a community organization due to like the lack of, I reached out to these organizations, but they did not get back to me. They didn't respond and were not, they didn't have any communication, if that makes sense. As also what I decided to do on my part was attend these discussion panels where these sources were present, and I was able to ask questions in regards to how they are able to expand and outreach to the community. Most organizations stated that their way of expanding is hosting more of these like social meetings, which I think is a great thing, but also looking at their mission of these specific resources, they do not include or have the space indicated for the BIPOC community to also express themselves. So there's that lack of being inclusive. And at the end, I just provided like a question for self-reflection of how do we target young LGBTQI plus BIPOC folks in the Central Valley to promote a positive mental health lifestyle, just to keep in mind. The action plan, the goal is to create a sustainable resource and space for these identifying folks to rely on for support, questions, promoting positive mental health environments, staying informed, and amplifying the voices of these folks. And the ultimate goal is to identify the unmet community needs and be able to plan more ways to meet those needs, but as a community, because I think it is important for the community to get together and they are stronger in that way to move on forward to meet those needs. Due to COVID, I would recommend taking a technological approach, which could be whether it be podcasts, social media accounts, and virtual events. This would allow the entire Central Valley to be an active member of this community involvement. Like my research did not focus in one county in specific, just because it's already hard enough to reach out or have people like express their experiences. So that's why I decided to take into consideration the whole Central Valley as well as clinical partnerships. I think that would be a great idea to do to present the data collected and recommend more of an inclusive approach to advocate for LGBTQI plus BIPOC folks, and just for there to be that representation of staff and like professionals who identify as being LGBTQI plus BIPOC folks. Here are my references. And I provided the resources, some resources that I found that are helpful in regards to mental health and focusing on LGBTQI plus folks. Acknowledgements. I'd like to thank the Central Valley Scholars for the opportunity given to me to be part of this program, as well as Angie and Daryl. They were important individuals in my research and study. Daryl helped with my understanding more on like data collecting and how to interpret that collection. This was something new for me as I've never done community-based work. So it was really good to have these optimistic individuals in my way of like navigating this type of research. As well as I'd like to thank and acknowledge the Central Valley and the community overall, because I feel like they also played an important role in my study. I was able to see how close community organizations and the community in general are able to get together and be able to just speak about these unspoken issues, as well as my fellow program scholars. I think y'all have been doing a great job, and I admire y'all as well. And I also like to acknowledge my supportive friends and family. And with that, I would like to end with a quote by Harvey Milk. It says, "All young people, regardless of sexual orientation or identity, deserve a safe space and supportive environment in which to achieve their full potential." And thank you. And I'm open to questions.